most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, our title that we're discussed is the 7 most important questions to ask your hip surgeon. So obviously, you're going in for hip surgery for some reason. It might be a hip replacement, might be a pinning.
Yep.
But these are the ones. This is pretty comprehensive, and Brad and I were talking about this. They don't all necessarily have to be of your surgeon. It might be his assistant. It might be his nurse. It might even be your physical therapist for some of these later on. So
yeah, this is a really important video because you ever go to the doctor and you walk out and you say, "Oh, I wanted to ask him that," and you completely forgot about it, and things are rushed. The doctor doesn't have a lot of time to spend with you, whatever. And so you can look at this.
Let's just say real quickly, Brad, yeah, you can get the printout of these questions. If you go to our website, bobandbrad.com, go to the program section. We have free programs there. And this one, just find the title. It would be under hip problems or hip
replacement.
Hip replacement. I don't know what it's under, but it's under hip something. And under there, you'll find this particular video.
Right.
The 7 most important questions to ask your hip surgeon. And then there'll be a printout.
Yep, PDF printout. Click it, and out it comes, and you've got it.
Then you got the question. Let's get started, Brad. Okay. Number 1, can you try physical therapy first? Imagine that, 2 physical therapists saying that you should try physical therapy first. But we've seen many times that, people think they're going to need surgery, and they have some therapy, and it goes really well. And they end up not even needing the surgery or delaying it.
Right. I've got a patient right now, extremely tight hips, limping around for quite a while.
A friend of yours, right?
Yeah. Well, he just had a stroke, too. But he's coming along, so we're working at this as well, and we're stretching it out. Things are getting better. He's probably going to need a hip replacement, but at least he's got some relief, and it's going to delay it, make things more comfortable until it's absolutely needed.
And at the very least, you're preparing the hip for surgery.
Right.
If you aren't even, if you still have the surgery, it's in better shape.
Yep.
Number 2, what is the risk to performing surgery now? So you want to ask, can I avoid surgery? Can I wait 6 months or a year? Is it going to compromise your outcome? Is it going to affect your outcome?
Sure.
Now, I don't think that's as important on hips as it is on shoulders. Like rotator cuff injuries can actually get worse.
Sure.
But it's still a good question to have. And, to me, I always ask the patient, is your health going to be okay in a year and a half?
Right.
Because sometimes you're not able to tolerate a surgery as you get older. So
yeah, if you have a heart problem, and that's
lung problems.
Yeah, the doctor will go over that with those precautions about what limits you from having a surgery.
Okay, number 3. Again, this is kind of all tied together. What are the alternatives to surgery? Physical therapy. There's anti-inflammatories. There's injections, and just education on how to run your life and keep from hurting your hip.
Right.
So number 4, what is the expected length of recovery? How many days will you be in the hospital? And then we have lots of sub-questions for that, too.
Right. Are we going to...
Yeah, go ahead. Let's go ahead and start. It looks like I'm number 1. How long will you need to follow the hip precautions? If you don't know what hip precautions are, they are guidelines given to the patient after surgery, and they include such things as, don't cross your legs and don't bend your hip greater than 90 degrees and all that. So.
Yep. And make sure that's clear because there's more than one type of hip procedure, and precautions are different.
Yes, for each doctor, they're different.
Next one, will you need full-time or part-time care? If so, how long? So let's talk about when you return home.
Right.
Are you going to be able to be independent, or you need to have a spouse or family member or maybe home care come in to help you out?
And that requires pre-planning, obviously.
Yep.
So,
Yep.
Will you need a hospital bed at home?
Yeah.
Good question.
Yep. How soon will you be able to walk after surgery? Weight-bearing status. Typically, as 100% weight-bearing or as tolerated, but not always. Sometimes you may have complications, and there are some restrictions for.
Well, especially if you fractured your hip.
All right.
And in that case, you might be non-weight-bearing. You may not even be able to. So
yes.
that's going to greatly affect your ability to get around.
Yep.
If you're not full weight bearing. I'm next. Will you need crutches or a walker? And if so, how long? So you want to again prepare ahead because you aren't going to go out to the store and get crutches, or I guess you can order online too. But when you're at home,
sometimes they give them to you, or they give they issue to you at the hospital.
Right.
But make sure that you don't want to be stuck to be waiting for a walker at home for 2 days. That's very uncomfortable. It's not safe.
Exactly.
When can you lie on the operative side? So sleeping in bed or on the couch, can you roll over on the side that's been operated on? Very important to know.
It's funny. It's usually sooner than I think. They allow it pretty quick usually. A lot of times on a recheck they'll say that's okay.
Yeah, and that's with I think with a fracture or something like that,
it might be
that's
different.
when you really need to pay attention more.
How soon will you be able to climb stairs after surgery? So if you have a lot of stairs, I can, in therapy, we'll a lot of times we work on that before you go home.
Right.
If you're staying in the hospital.
Yeah, there's specific pattern on how to go up and down stairs to take the pressure off your involved or operated
There's
hip.
a right way and a wrong way.
Mm-hmm. When can you shower after surgery? That's a really good one. You don't want to have an infection in that incision because that will really raise havoc in your life. So get that very clear.
When can you drive? It's an important one because when are you going to be able to start getting around?
Independence,
Right.
Yep. How soon will I be able to resume normal lifestyle activities besides walking, gardening?
Well, going back to work.
Yeah, going back to work. Yep.
The people at work are going to be asking you, when can you come back?
Yeah.
So that's a good question to ask. Again, doesn't necessarily be the surgeon. I don't know if I'd load up the surgeon with all these questions.
Right.
But I would ask someone that is in the know.
Yeah. If it's a typical hip replacement surgery, they can oftentimes say it's probably going to be this. But if it's a fracture or something like that, there's too many other variables that may intervene with that.
What are your lifting limits? That's a good one.
Yeah, and you got to pay attention and listen to them.
I left this next one for Brad.
Oh, yes. When is sexual intercourse feasible after surgery?
Yeah.
It's a good one to know because you don't want to have a dislocation or
exactly.
Mishap there. That's a
which,
problem.
again, this is probably a later question. Which sports can you participate in?
Yeah, well, don't plan on none for a little while.
Yeah. And there's some that you may never be able to do again.
Yeah, I knew someone, I know him, I haven't seen him for a while, but he had a total hip replacement in his early 50s, and he plays adult, they call it masters hockey.
Oh, my gosh.
Yeah, and he wants to get back into it. I'm saying, forget it, buddy. But
well, at least it's not pounding.
Well, when you fall.
You're
going to fall.
Yeah, you're going to
fall.
fall.
In your 50s, you're playing hockey, and even though they don't go after people aggressively, but they're guys.
Yep.
Things are going to happen.
Get caught up in the emotion.
Yeah.
All right, let's go to number 5. This is the main questions now. In this one, I hope you can maybe find out without asking the surgeon, but how many hip surgeries do you do a year, and how many surgeries of this type? And this is a really important question because they have found through studies that the surgeons that do more hip surgeries obviously have better results. It just makes sense.
Right.
If you're doing one a year, I don't think I'd go along with that guy.
Right.
If he's doing, I don't even know if I'd go along with the guy that does shoulders, hips, is doing everything.
Yeah.
I would like the guy that's doing a lot of hip surgeries.
Right.
So.
Yeah, and you got to do homework on that.
Right. Number 6? What are the risks of a complication, and what is your complication rate? So you can find that out. How often does this doctor have people have problems, and how often do they have people die? And
a big one is infection rate.
Yeah.
If you can look at the percentage of perfection rate, their history, that's probably one of the biggest things.
Yeah. Number 7, final question, but then there's some sub-questions on that too. If you're going to undergo hip replacement surgery, you may want to ask these specific questions then. These are just for hips replacement. So, number 1, what is the implant made of? You want to know if you're going to set off metal detectors on the airport.
Right, yep. And if so, then Do you have
You have to
can
let
you
them know,
carry
or,
a piece of paper
yeah.
or something in your wallet that helps you get through? And because that happens. This has been going on for years.
Yeah,
This way.
yeah, actually.
How long will your joint replacement last? That's a good one.
Yeah,
Is it going to be 10 years, 20 years? If
right.
you're going to be playing hockey, well,
Yeah, it's gonna be less than that. And this is a good one for your physical therapist. What can you do to keep your joint replacement working as long as possible? Um, again, your therapist can guide you on that.
right. Yeah. What activities or factors could make your joint replacement wear out more quickly? Again, a physical
Falling in
therapist.
hockey would.
Yeah. Obviously, any falls is not going to be good. But can you go back to running?
Right.
I'm quite certain that's a negative.
Probably no. Sorry.
But biking, that
Yeah.
may be a different situation. You're going to have to make sure your seats, your bike's adjusted properly, things like that.
Yep.
Um,
Good one for your therapist again.
mhm.
And this one's going to have to be the surgeon or maybe his assistant. Will you need antibiotics for dental care?
Oh,
So-
right. Yeah. Yeah, I know I've had knee and hip patients. When they go to the doctor, they've got to take,
They got to let them know.
yep, they got to let them know. And sometimes they have to take a round of antibiotics before they go in. It's something about you can get infection.
In your mouth, and then you can travel to your hip.
Right.
Probably.
For some reason, these replaced joints
Really suck it up, don't they?
attract these.
Yeah.
And you can get infection without even opening the skin, and it's amazing how that happens. But it's definitely a concern, and they should make you very aware of that. But
Yeah, it happened to mother-in-law. It was her knee,
Yeah.
but she didn't. Obviously didn't have any cuts down here, but she had some nosebleeds and stuff, and I don't know if she got it through her nose.
sure,
Picked up a bug.
yep, it gets into your system,
Yeah.
and those
It seems to go right towards that joint.
right. It's
So-
the metal in there, your body. It's not a normal thing to have
Right.
that in your body, so it reacts differently. It's a good question to ask.
Yeah,
your
it
surgeon.
is. I'd like to hear a surgeon espouse
Yeah, maybe
his
we can
few
do
thoughts on that. Yeah,
Do a video on that or a
yeah,
podcast.
yeah. That would be good. All right, thanks everybody for
Oh,
watching.
we're already done.
Yeah, we're
Wow.
done.
Thank you.